This conference will now be recorded.
Hello, I'm Lauren Satterwhite with the NC Medicaid EHR Incentive Program, and welcome to Program Year 2020, if you can believe it. In this webinar, I'm going to cover some of the program basics. This program has been around since 2011, incentivizing Medicaid providers to meaningfully use their electronic health records, or EHRs, with the hopes of improving patient care and reducing healthcare costs. In doing so, providers can earn up to $63,750 over 6 years of successful participation. Now, before you get started with your Program Year 2020 attestation, make sure that you're still eligible to participate in Program Year 2020. First, you need to meet the Medicaid patient volume, or PV, threshold. That's 30% Medicaid enrolled encounters in your practice within a consecutive 90-day period. Pediatricians can qualify for a reduced payment if they have 20% Medicaid PV. To calculate your Medicaid PV, take all Medicaid enrolled encounters in a consecutive 90-day period from calendar year 2019 or the 12 months immediately preceding your date of attestation. And you'll divide that number by all the encounters that you had in the same period. If that equals 30% or more, or 20% or more, if you're a pediatrician, you're in good shape. Secondly, you need to have a 2015 edition of Certified EHR Technology, aka CERT, and you can check to see if your EHR is certified by going to ONC's Certified Health IT Product List website. As a reminder, if you have upgraded to a 2015 edition of CERT, make sure that you're updating that number on CMS's RNA system. The third piece of eligibility is meeting the CMS-issued meaningful use, or MU, objectives and the clinical quality measures, or CQMs. In Program Year 2020, EPs will be attesting to Stage 3 MU, and for a link to the MU specification sheets, you can visit CMS's website, and we also have a link to them on our website as well. In Program Year 2020, all EPs may use a 90-day MU and 90-day CQM reporting period. That means at a minimum, all providers will report their Stage 3 MU data and data for at least 6 CQMs from a consecutive 90-day period in calendar year 2020. The MU and CQM reporting periods are the consecutive 90-day periods in which you demonstrated meaningful use of your certified EHR technology, or your CERT. If you've switched practices since last time you attested, you can still attest this year if you meet the program requirements. If you have attested in a previous program year, if you attested last year essentially with another state, please email ncmedicaid.hit@dhhs.nc.gov prior to attesting for program year 2020. And if you're not sure if you're eligible to participate, we do have a list of all the providers who participated at least once, but less than 6 years, on the NC Medicaid EHR Incentive Program website under the Are You Eligible tab. If a provider is not on this list and the practice or provider is unsure of past participation, send us an email and we'll check it out on our end. Providers do have until April 30th, 2021 to submit a Program Year 2020 attestation, but we do recommend submitting early. In fact, if you submit by February 28th, 2021, we will review your attestation before the program year closes. If you don't meet all the eligibility requirements this year, we do encourage you to apply next year. Participation years don't need to be consecutive, so if we don't see you in program year 2020, we do hope to see you for the last year of the program in program year 2021. All the links I referenced in this webinar will be made available in the comments section below. Thanks so much for tuning in today, and if you have any questions, please send us an email. Our email address is ncmedicaid.hit@dhhs.nc.gov.